Good afternoon. My name is Dr. Sonia Elgeuro. I'm one of the reproductive endocrinologist and infertility subspecialist at Boston IVF, the Albany Center. And I started working in the practice back in 2014. And I feel very privileged to be helping families and patients like yourself and your wife, Olivia, build their family. And one of the most enjoyable parts of practice has been building, patient physician communication, which I think we're going to talk a lot about in today's webinar. But would be great if you could give an introduction for yourself as well, Keegan.
Yeah, well, thanks, Dr. Elgeuro. It's great to be here and great to be here with you. You've been with us through the entirety of our fertility journey. So again, I'm Keegan Prue. I would say, a former and current patient of Dr. Elgeuro at the Boston IVF Albany Center. And I'm thrilled to be here to talk about male infertility, ways that men can support their partners and play an active role in fertility treatment, and how you can really survive and thrive and implement a lot of tips and strategies that can help you during what we know can be a really, really difficult experience.
So I want to start out, Keegan, by congratulating you on your new book, The IVF Dad, which is a fantastic read. And I was hoping we could start out by having you talk a little bit about, your inspiration, for writing the book.
Yeah, of course. Well, like I just said, we know that anybody who's been through infertility just knows what a lonely journey it can be and how difficult it can be, not just physically, of course, but emotionally. It can be just a big challenge in a lot of ways. And one thing that I certainly noticed while we were on our journey was that there are so many wonderful resources and places where women can connect and find information and hear each other's stories, which is really wonderful. There's a great community out there. But for me, as the male in the partnership going through infertility, I didn't hear a lot of men sharing their story. I didn't hear as many resources that were really written to help men navigate this difficult experience. And so, as we went through our journey, and I started to do some writing just to kind of reflect and process what we'd been through, I realized that this could be a really powerful tool to help men and couples really learn how to navigate the experience. So I started writing, and before I knew it, had really kind of not only written out a lot of our story, but written a lot of kind of basic information that I hope will help people understand the basics of diagnosis and treatment and what to look out for. And then also some tips around mental health and how to support yourself, support your partner through this really difficult time.
Right. Yeah, I think you bring up some very good points. I think one of the things that we don't realize is that when men are going through infertility with their female partners, that even though they may not be going through the process together physically, the emotional journey is certainly the same journey. And I think due to a lot of social stigmas, if you agree, and lack of resources, like you outlined, it becomes difficult for male partners to have an outlet for their stress, which is a real thing, as you know, going through fertility treatment. And sometimes it can extend into the stress of their relationship as well. And so I think that that's a very important point, and this book itself lends to a great outlet for men who are on this journey.
Yeah, absolutely. And there are some really eye-opening things that I've certainly learned throughout the journey. One thing that I think very few people potentially know before they find themselves pursuing treatment is that current research shows that potentially up to 50% of infertility cases involve some degree of male factor infertility. That's such an important thing that I try to emphasize because I want men to know that even from the very start of the journey, it's really important to do your part and to take an active role in testing and getting your semen analysis to make sure that you are healthy and that there's if there are any issues, it's something you can discuss with your medical team in advance. So that's something that's really surprising. And then, the other thing, a study I recently read showed that for couples going through infertility, they can be up to 3 times as likely to break their relationship get divorced, break up, whatever it happens to be. And I think that speaks to what you said, is this, it can put a tremendous amount of emotional stress on your relationship. And we certainly learned things when Olivia and I were going through this that hopefully can help others. I think communication is obviously a key, but those two pieces of information really opened my eyes and were important things to learn, and important things that I hope people who are watching will take away and think about how maybe some resources can help them.
Yeah, absolutely, absolutely. And I think this notion of understanding, that male factor is a contributing aspect to infertility. Sometimes there's this notion, and again, stigma, that all problems are derived from the female. But in fact, like you mentioned, it could be a third to a half of cases are involved with male factor. And as you know, that can be broken down into many causes, some of which are treatable. Could be endocrine. One of the most common problems is defects in sperm production. We use the word spermatogenesis. And another cause is simply transport of sperm. That could be a problem that could be remedied through surgery. And finally, sometimes we truly don't know, and we use the word idiopathic. So there's quite a range with male factor. And like you were alluding to, doing your part in getting the appropriate testing and sometimes additional testing in the form of ultrasound or a urological consultation can be very key to furthering, the couple on the infertility journey.
Yeah, absolutely. And something I wondered about a lot too is, you know, there's so much information in the kind of online community about ways in which the female partner can kind of optimize their health choices and things. What advice would you give men who are looking for ways to sort of do what they can to just make lifestyle choices that optimize their sperm health?
Yeah, so I think, in terms of how we counsel men and how urologists counsel men, I mean, I think there's a lot of overlap where on a basic level, you want to be healthy. So, avoiding excessive alcohol consumption, avoiding any type of smoking, be it nicotine, be it marijuana use. We know through studies that not always, but some male patients can be affected by excessive alcohol and nicotine and marijuana use. So that's number one. Number two, we also know that certain systemic conditions, for example, obesity or poorly controlled diabetes, can have a negative impact on spermatogenesis, which, as I mentioned before, is sperm production. And so, if a gentleman were to lose some weight, and doesn't need to be a large amount of weight, but even a percentage of their body mass index, and they were to optimize their glycemic control, many times a few months later, when we repeat the semen analysis, we see sometimes market improvement in the semen parameters, and that may be enough to move the needle and for the couple to achieve pregnancy, sometimes even naturally.
Yeah, which is such empowering information to have, right? Because I think certainly, correct me if I'm wrong, but the research I've seen says that the time it takes a body to create a sperm cell is somewhere in the 2 to 3 month range, and so that's a
Absolutely.
pretty powerful realization, right? Is
Yeah,
that with some changes, you can actually improve
yeah,
your sperm quality and health, which is great. And the other thing that
absolutely.
I think is so important that you highlighted is that there is a lot of overlap in what your partner might be doing. And I think one of the biggest keys that always try to emphasize, that I emphasize in the book, that I emphasize when I'm talking to other men and couples who are going through infertility, is look for ways that you can support and partner with each other. In all likelihood, your partner is going to be working to make some lifestyle changes or choices just to optimize their own fertility health. So I think there's a great opportunity for men to also look and say, how can I do the same things? How can I show that I'm here supporting, being part of the team, and that I'm contributing in the same way? And I think it can really turn into a bonding activity for couples too. You can do things like picking a new gym class or exercise class to try together, or just committing to going to the gym at the same time, just to show that you're in this together, or look for some new healthy recipes that you could cook together. Finding those ways to connect and show that you're just as involved, just as invested as your partner can be a real key to thriving through infertility.
Absolutely. And helps the couple get through that emotional journey together.
Yeah,
Yeah,
absolutely. And that
absolutely.
can be that can be in some ways the hardest part, right? Is that there is this really difficult emotional side, and I think certainly for men, one of the biggest stereotypes we deal with is that there are a lot of messages from society that it's not okay for men to reach out and say, "I need help. I'm feeling upset. I'm feeling some amount of grief for what I thought our family building journey was going to be like." And so, any opportunity to open up around that can really help, and again provide another really good opportunity for couples to bond and show that support to each other.
Right, right. And I think you just brought up, a good point, this notion of, communicating and being open with your partner. I think without that, how does the other individual know what you're going through or understand that you're identifying their emotions and their hardships through the journey? So I think communication between the partners is key.
Yeah, it's so key, and it can be really, really difficult at first. These are difficult conversations, not ones that any of us expect to have, right? I remember, a very cold January day when Olivia and I were about 6 or 7 months into just trying to conceive on our own, and really having a conversation around, how are we feeling about this? Something is not happening for us yet, and we're at the point in our lives where we're seeing other friends have success and get pregnant. And so, that was our first real kind of heart to heart conversation that we had on that very cold January day around how are we feeling about this? What do we think maybe we need? What different supports do we need? And what should we do? And that's a good place to start. I know that it can feel difficult, and certainly something I've talked with a lot of couples and men about is that it can be more difficult, or people can kind of struggle to figure out, how do I get my male partner to open up more about what he's feeling. And I think Olivia is always very skilled because she just starts with kind of simple questions that are not too much pressure. Just, how are you feeling? What do you think? I think that for better or worse, again, men hear a lot of messages from society that it's not okay to share feelings, to ask for help. So I think asking kind of more simple starter questions like that of just how are you feeling? What are you thinking? Can help start a conversation. The other
I
thing.
agree. And I think it doesn't have to be at some pivotal juncture, like right before treatment. Even the consult itself, patients will tell you the consult is difficult because we don't envision ourselves as either male partners or female partners needing to talk about our fertility, needing to seek testing, discussion, treatment. We think that it's going to happen naturally. That's kind of how we're wired when we think about fertility. And I think part of it is the stigma, society. How often do we hear about, hey, there may be a problem conceiving?
Yep.
We don't really talk about that.
Yeah.
There tends to be more discussions about contraception and not conceiving, especially in our younger reproductive years. So I think even just being open after the consult and sort of debriefing can be really helpful. And you think about, the initial consultation we had together. It's a
Yeah.
lot of information, and I think that's where the relation building starts. Just even gathering history and relaying what you've gone through to get to that consult.
Yeah, absolutely. And you're right, it does feel like such a big moment to have that initial consult. And one thing that really helped me, and I think helped Olivia too, is we did some research in advance just to learn a little bit about sort of what are the different diagnoses, what are the different options that we might find in pursuing fertility treatment. And that helped us feel so much more comfortable in that initial consult, and of course in all of our subsequent conversations, because to your point, there is a lot of information. It can be very confusing. There's a lot of acronyms. You have to understand, what is ICSI, what's an IUI, what's IVF, what is the difference between all these things. So for us, listening to podcasts, reading kind of blogs, and just hearing other people's stories really helped. Certainly helped me feel like I understood what we were talking about when we got to that initial consultation, and helped me feel involved as the male partner, which I think really helped.
Yes.
So I would definitely recommend that to anybody who's earlier in your journey. See what you can do to just kind of understand a little bit about what's going
Great
on.
tips. Yeah, great tips. I think as well, many patients have told me that they've had sort of a fear, what is that initial consult going to bring? Am I going to say that you're the problem? You're the problem. They're almost concerned that there's going to be a label and there's going to be blame.
Yeah.
And, I think I can see how patients would be worried about that. They don't want to feel responsible, for the infertility. They may have personal feelings as if they failed,
Yeah.
that they're hurting their partner, something that, needs to be dispelled. This is a couple issue. This is a family issue. And as you know, when we talked about the different types of infertility, including male, I mean, many times it's multifactorial, that there are a combination of male and female factors. And even if there isn't, like we were discussing, this is a couple going on the journey together and supporting each other, as they, are moving towards success.
Yeah. And I think you always did such a great job of emphasizing, what do we think about this? What are our options here? And I think even just that language can be really helpful for couples, especially at that early stage where it is so uncertain and you're feeling very raw. Like you said, you're feeling potentially a lot of shame around, is this an issue with me? Is this an issue with my partner? Is it something with both of us? And really stopping and emphasizing, this is a path that we are on together, that we're going
Correct.
to work together on and discuss the various options, and really find ways to support each other,
Right.
is so critical because it's the only way we get through something like this, is through that
Absolutely.
support.
Yes, and I think too, when, couples are having these discussions, very sensitive discussions and dialogues with their physician, like you mentioned, it's not a black and white pathway. A lot of the decisions, as you know, are a balance of your values and your emotions, what your limitations are as individuals and as a couple, and then balancing all of that with the science, which is not easy to do, but so important to know that it's so individualized.
It is, and that's a point where I would just encourage everybody to really, listen and view your doctor as a partner in the process. They have your best interests in mind. We always knew you had our best interests in mind, and you always did a great job of presenting. Here are the options. Here's how I sort of view them from a scientific standpoint, based on the evidence and what we know about treatments and what works based on the research. But then, involved us and invited us into a conversation around what's going to work best for us. I certainly remember when we were thinking about coming back for a transfer for, our second daughter, who Olivia is expecting now. We sort of came in thinking, it might be time to do another egg retrieval because, we kind of hear our clocks ticking, right? We're, in the category that I think so many folks who go through this are in, where we're in our mid 30s and are thinking about our long-term family goals of not just having one child, of hopefully having two. And so we're feeling that pressure on one side, but it was really helpful to have your perspective to say, listen, we were fortunate to be in a position where we had another embryo that we had tested, was, genetically normal and tested. And so, decided ultimately based on that counsel to, let's not rush forward with another egg retrieval and all that goes along with that. Let's see what happens with this embryo. So, but it was very much a conversation between all three of us, and was really helpful in that way.
So, Keegan, we talked a little bit about what inspired you to write the book. I'd love to hear about, from your perspective, what was your favorite part of the book? What did you really enjoy writing about and sharing?
Yeah, the most meaningful thing definitely for me was just writing out our story. And I think that one of the most powerful ways that we can learn and help each other is just by sharing our stories. It helped me certainly feel less alone when I heard others sharing their story about their journeys. And so even though we were writing about I was writing about really difficult points in the journey, and of course the good things too, but being able to write about experiences, like how we navigated kind of grieving and moving through our two losses, was really a meaningful experience to just write that down, hopefully in a really honest way that will help others to know that, if you are, heaven forbid, going through something like that, there are ways that you can sort of move through in your own way to process those really difficult experiences. So while it was really difficult to write those things, it was really meaningful. And of course, on the other hand, it was really fun to write, and really have recorded some parts of our story that were, more fun. I have, there's definitely some guest appearances from some familiar faces on the team, although names have been changed. But, we have, obviously, we're also very close with Michelle from your team, one of the wonderful nurses at the Boston IVF Albany Center. And she was even so kind as to, on a couple of our beta days, log in to figure out, find out what our beta numbers were, even on her days off, to call us. And so writing about those experiences where, Michelle was sharing that wonderful news with us was such a nice thing to reflect on. So it was great from that end. But what I then kind of moved into was just writing out first the informational piece to kind of address what we talked about earlier. Of there is so much information about the process, that in my professional life I'm a teacher, and so I kind of found there was this great opportunity to take all the things I've learned and try to not go into every single detail, but really explain as clearly as possible, kind of from the very high level, what are the different ways that your diagnosis and your treatment might play out, and what do those options look like, and just what do you need to know from a practical sense. And then from there kind of led to this third piece that's in the book, which is just about mental health and your relationship with your partner and the ways that you're supporting yourself, and tips to help that, but also just some both funny and engaging ways to recognize all of those stereotypes that we hear as men. I have a section in the book that's called, Mr. Doofus and Mr. Debonair, which is kind of like the old highlights Goofus and Gallant, but it's like these instances of what's something you might say as the male partner that's like totally off base, not supportive, even if you don't mean it that way. And then what's a better way to say something to your partner to be more supportive to them? So it was fun to provide these tips. And again, I feel like I kind of got to draw on my experience and education to hopefully provide some useful information for people out there.
Yes, yes. I think that what I really loved about the book is it's such a great balance of subjective data and objective data, as you outlined, the important points of what to expect, but then also having the courage to really put your journey at the forefront, which is very hard to do. It brings a lot of vulnerability,
Yeah.
out. And, as we've talked about with the stigmas that exist and sometimes societal pressure and partner pressure, it's not easy to do. But I think that this book has probably already helped many people. And the goal is obviously for more men, and sometimes women, hearing about the dad perspective,
Yep.
to really garnish support through this type of outlet. It's really wonderful.
Yeah, I really hope so. And I hope it will also kind of normalize all the difficulties and, the like silly things that we go through as people who are going through infertility. It's so common to see kind of memes and things online of the insensitive things you will hear, even if family members, friends don't mean it that way. It's the just relax advice and things like that, which we all deal with and know how painful that can be, even if it's well-meaning. So I think being able to pick up on things like that and just normalize all the things we go through, and all the difficulties we experience. I write about another kind of stereotype that I think was certainly very real for me, which is that I think men want to feel like we're taking action or fixing things, and we know the reality is during fertility treatment, there's a lot of time when all we can do is wait, be an emotional support for ourselves and for our partners, and there's really no action to take. So I certainly found myself at points kind of going down the Google rabbit hole of having 45 tabs on my screen open of different research studies and blog posts and things, where I was trying to tap into that urge to take action. And I'm hoping that explaining things like that in the book will help others recognize that those things can be normal, but
Right.
that also, there are ways to push past that and react in healthier ways that will help you actually feel better and do better and support yourself and your partner better, versus falling into some of these behaviors that could actually make your journey even harder.
I agree. And I think one thing that anyone can attest to who goes through fertility treatment is that there's a lot of waiting. There's a lot of gaps.
Hmm.
The gap to wait for testing, the gap to wait to start treatment, insurance approval,
Yeah.
getting your medications delivered.
Yeah.
and then waiting to see, what is my egg number and what type of embryos, do
Yep.
I have? Are they healthy? So there's a lot of waiting periods. And I think the different phases of the treatment certainly invoke different types of emotions. I mean, if you agree, as you're waiting on that report, I mean, there's a plethora of emotions. I mean, what if there are no healthy embryos?
Yeah.
That's the couple now going back to, what mentally may feel like square one to go through the physical and emotional process again.
Yeah, and that's such an important piece too, and I feel like you were always very, very conscientious about walking us through setting expectations because that is such a key part of the journey, and we know that there, I call it in the book the infertility yo-yo, where it's like you're going from one kind of barrier to hopping over the next barrier. When you have gone through an egg retrieval, as you said, you're first just hoping and wondering how many eggs will we get, and then from there you quickly progress to how many of those eggs are mature, to how many of those eggs are going to fertilize and create viable embryos, and then if you're doing PGT testing as we did, how many of those are going to be genetically normal. So there, it does feel sometimes like there's always another weight and another gate to jump through, and that unfortunately the reality usually there is that the numbers are dwindling. uh,
Correct.
and so I think it's very important, and I always appreciated our conversations because I think you set us up very much to understand and manage our expectations well. And I try to explain that in the book too, of knowing those expectations can be very important because I think even at a very basic level, some people could go into, pursuing IVF, for instance, thinking, well, this is just a guaranteed success. And we know that's not the case, right? Unfortunately, technology has improved, success rates have improved, certainly in the last 10 or 20 years, but it's not a guaranteed success. And that's one of the hardest things, I think. So hopefully that can help people to manage expectations well, which I think is such a huge part of the emotional battle.
Yeah, and I think, it's hard putting so much into a cycle as a patient physically and emotionally and sometimes financially and think that, wait a second, this process may not work. I mean, that's a whole struggle there, trying to deal with that possible outcome separate from, the personal feelings of infertility and separate from, the emotions with your partner, so there's many layers, I think, to all of this, mental processing. And like you said, I think talking about expectations is huge.
Yeah.
And I think, as patients, having those expectations allows you to navigate it through it a little bit easier, versus, thinking that this is automatically going to work, or, not understanding the process of attrition, whereby, like you outlined, after the egg retrieval, there's what am I going to have for fertilization? How many are going to get to PGTA testing? So expectations, I agree, are very key in this process.
Yeah. Absolutely. And I tried to include as well in the book a lot of really concrete strategies and tips that you can use, whether that's just kind of modeling conversations you can have with your partner, to kind of help manage your expectations, ways you can, implement some coping strategies if you do unfortunately get in a situation where, you perhaps have a cycle that doesn't lead to any viable embryos. Unfortunately, that's something that does happen to people. So I tried to include a lot of strategies and tips that can hopefully be helpful somewhat to help manage those difficult things because it can be very hard.
Yeah. As a patient, when you were going through the process, what were some, I guess, outlets that you availed of to help you personally get through the journey?
Yeah, I think the most important thing definitely overall was just connecting with other people, and it was certainly hard, right? Like we've said before, there can be so much shame and so much stigma around this, but we took a couple of steps along the way to really open up about our journey, and as hard as that was, what we found on the other side was there was, first we felt so much less alone. Second, we found family, friends, neighbors who had been in the same situation, and have just built such amazing connections with those people, many of whom we had no idea had been in the same shoes that we were. And so while it can feel so difficult to open up about your journey, that's the first thing that I really recommend to people is you just take that step. And whether it's just one person, and we're living in time when, for all the sort of good and bad about social media, there is a really active social media community around infertility. And so you can find people if you feel more comfortable in that sort of anonymous setting, finding others to connect with and sort of share stories or look for support. You can do
Right.
that. But you can also take that step. And I would really encourage people to think about taking that step of sharing with friends, sharing with family. One of the scariest moments in our journey was when we had written up a pretty long Facebook post just sharing, here's where we're at with our family building. We had obviously not been successful yet. We had been through the first of our losses, and we kind of just put it out there after, of course, discussing with close friends or with close family. But as scary as it was to put that out in the world, literally within a couple hours, we had so many text messages, calls, emails from people we, you know, were very close with and people we hadn't heard from in years, just saying, "Hey, I've been there. Hey, I'm going through this right now." And it was such a shift in our mindset in that moment to say, "We're not alone in this. We know
Right.
so many people who've been through this."
Right. So being open, honest communication, and
Yeah.
really just seeking out that support, whether, like you mentioned, it could be anonymously, it could be through an online support group. It could be non anonymously, where you're reaching out to friends and family. And like you said, sometimes you get surprised to see that others have gone through this process.
Yeah, absolutely. And then, at a practical level too, a couple of things I always find really helpful and that I think a lot of others have said they've found helpful is just some sort of physical activity. I'd say you don't have to go out and sign up for a CrossFit class if you're into hiking, if you're into walking. Having some kind of physical activity can really help to just sort of move, process things, have thinking time or connecting time. Olivia and I just did a lot of walking and talking about what we were going through, and that was so helpful to I guess kind of just blow off steam, but also process things. And then, the second kind of more practical thing I would say is I definitely started to practice meditation during all of this, which was really helpful for me. And when there's so much anxiety associated with infertility. So when I was really spinning out, worried about things, that practice helped me. And again, that can look differently to different people, right? If you're a person of faith, maybe prayer is something that's really meaningful for you, or just spending time in nature can be a really great way to just kind of give yourself some mental space. But anything that gives you a little bit of mental space is so important because it can be so easy to just get caught on that hamster wheel of thinking about the next cycle. What's the next thing that's going to happen? All of the what
Yes.
ifs.
Yes, yeah. Important to know too that there are other online resources separate from social media. So I'm sure you're familiar with the Resolve organization.
Yeah.
They do wonderful things, and of course, in many different states and many different cities. So that provides a really, opportune forum as well for support for men, and of course their partners as well.
They do, and I so appreciate the work that Resolve does, not just for providing support groups that can be so useful, for anybody going through this. But I really appreciated that Resolve, and I know Boston IVF as an organization is very committed to this too, is explaining advocacy opportunities.
Yes.
We certainly know that there's so much advocacy to be done around infertility coverage and insurance, and availability. And there was right around when we were starting our treatment, the large employer mandate passed in New York State, which was truly a game changer for us. And so that really led me to just engage in some small ways, writing letters to the editor, making efforts to make sure that other people knew what was out there. I think advocacy can be such a great way to turn the difficulty that you're going through into
Yes.
something positive.
Yeah, and I think something that men specifically can do is that they're feeling even more part of the journey. So they may not feel that they're physically going through it, but maybe these advocacy efforts that they're making really help them, cope and really help them feel even more part of the journey
Yeah,
because
absolutely.
it's an active effort.
It is, and it can be, it can be something big. It can be, attending a rally in your state capital, or writing to, one of your legislators or state representatives or something like that. Or it can be something much smaller. It doesn't have to be something huge like that. It can be writing a letter to the editor in your local paper during, National Infertility Awareness Month or something like that. Or it can be, talking to your employer about the importance of infertility benefits and whether that's something they might consider including, in the future. So there are a lot of ways that advocacy can look like, and I think that's so true. It can be something really meaningful for men because it is a more active way to be involved.
I agree. So, Keegan, I really want to thank you for your time today, but most importantly, just your courage, for coming forward and writing this fantastic book that, again, like I said earlier, not only is a great resource for men, but also for females going through this to get the dad perspective.
Yeah,
So,
yeah,
I
good.
know it takes a lot of courage, and I really thank you for that. And so, Keegan's book is on sale, and we're going to have the link attached to this discussion. And Keegan, do you have anything else to add before we close?
Yeah, well, I would first of all be remiss if I didn't mention, as I said at the beginning, we've obviously been through a lot with Dr. Elgeuro, and just so appreciate everything that you and your staff have done with us. We always say you have truly made miracles happen for us, and so anybody who gets the book will notice, there's two dedications. The first is to Olivia because obviously, I wouldn't be anywhere in this journey without her. But the second is to you and your staff at Boston IVF Albany. We just so appreciate everything you've done for us over the years. We truly can't thank you enough. Every time we, get a nice hug from Eliza, it reminds us what you've done for us. So we're so appreciative of it. And then the second thing I just want to make sure I mention too is we were just talking about advocacy, and one thing that is very near and dear to my heart is anything that we can do to help couples afford fertility treatments. We're in a very fortunate position to have insurance coverage, but know that there are many couples out there who are not in that position. And so part of the proceeds of every copy of my book sold go to the Stork Foundation, which is a foundation that makes grants to help couples afford the cost of fertility treatments. They do incredible work and have their current grant cycle opening up tomorrow, September 1st. Folks may be watching this later, but would definitely encourage you to check it out. But that piece is so important. It's a win-win for everybody, right? Hopefully, folks will check out the book. You can have a great resource that can help you. But at the same time, some of that money is going straight to the Stork Foundation to help other people who are in these shoes. So it's a great win-win, and something that, like I said, is very near and dear to my heart.
It's wonderful. So you're most welcome. And I also want to thank our team at Boston IVF. Like you mentioned, it's a team effort, and we can't do this without our team and Michelle.
Yeah.
And I'm just so thrilled for you and Olivia and your family, and can't wait to hear the good news for baby number two.